We're back again.
Yes, indeed.
What a fantastic week we've had, and
Lovely. I thoroughly enjoyed it.
Absolutely, and it's been wonderful learning a lot more about what you do with Mr. Aslam as well as the whole team at the charity. Now, today I want to talk about what you do in terms of teaching and providing extra teaching within the hospital in Pakistan. Why do you think that's important?
Both of you, spleen-wise, no clue. Okay, so we want to improve the technique. I've worked in Africa for a couple of years, and I think that sort of experience a lot of people should have, because what it teaches you is you should be able to do a lot with less. Because I think over here we are spoiled. We've got what I call the tick disease. So if there's an investigation to be done, they just tick whatever is to be done, and a lot of it is unnecessary. Whereas if you were to pay for it, I think you would certainly think twice before ticking. So having worked abroad, I'm very strict with my own staff as to what they take. But when I'm now teaching and training, and I've trained people in Malawi, for example, I'm training people in Kashmir, I'm training people in Pakistan, and for me it's easier because I can speak the languages of the various countries I've talked to you about. But for those people who are not conversant with the language, it becomes a bit more difficult. But having said that, you see, I think the British way of teaching is methodical, it is structured. And if you can teach basic stuff with that sort of a framework, then it's easy. So a lot of the people that go from here to train and teach, I guide them to a certain extent, and some are just natural teachers, and they can break down a complex task into something simple. So it can be done, but it's a question of the will to actually be able to want to go and the will to be able to do it whilst you're there. Because this is not a holiday, it's very hard work. People that go there, they wake up at 6 o'clock in the morning and work till 8 or 9 at night. So, they do really give 100% that go from here. Yeah.
I would like the viewers to watch a video with us where we're actually going through a teaching session with some of the doctors and nurses in Pakistan, and you have a 15-year-old live patient that you're actually using as part of your teaching process. First of all, why was that important for you to actually use an actual patient from the hospital? And I would love for you then to explain just a little bit more after this video. Let's just watch it.
I'm not clear, does he eat enough in the day or not? अमीने कहा वो कम खाता है या normal खाता है वो ज़्यादा खाता है? Yeah, so we need to ask that now. So is his appetite good, bad or normal? That doesn't fit in. So, you can't have a good appetite and look like that. Yes, but as long as you've got a good appetite, there isn't a problem. So then you have to think in the history, which conditions do you eat well and not put on weight? Sorry? Malabsorption is one. What else? Thyroid. Yeah. What I'm basically teaching them in this video, and this took a couple of hours in fact, the whole story to unfold, is to first of all teach them how to approach the patient. With children you've got to be gentle. With children you have to have soft hands. And it's a question of history, which you have to take sometimes from the child, sometimes with the help of the mother. The younger the child, the more the mother comes into the picture. The younger the child, the more difficult to examine. That's why I think you have to have the technique. And here, as it happens, a 15-year-old who is very ill wasn't really asking us many questions. But a younger child, the methodology would be different. So it's a question of history, examination, and then investigations. So whilst we're doing all that, it's a question of management until the diagnosis comes through. And sometimes the diagnosis is not that easy. My point was not to actually come to a diagnosis, but how to work towards it. That's what that video was all about.
I think I saw you getting a bit cross with one of the doctors when she grabs the arm of the little boy quite harshly, and you're not very happy with that. Why is that? Obviously, apart from the obvious that it's not very kind.
I think what we've got to realize that you are dealing with a human being, and dealing with children, particularly if the smaller they are, the more difficult it'll be to examine them. And you might make them cry, for example. This particular child was older, was quite ill, And I think the parents were probably grateful that we were discussing and trying to sort out this child's unsolved problem. In the approach to patients, you've got to not only respect them as human beings, but also you have to go through the etiquette of being a doctor. Because being a doctor is to get a diagnosis, it's not like a plug-in system that gives you an answer. And the patients should not expect that either. But I think if you're able to go through the history in detail, and if you go through the rigors of the examination of a patient in a structured sort of way that is gentle and respectful, chances of you getting an answer are much better.
Do you think that problem is more in the developing countries versus the developed countries like the UK, where doctors are quite abrupt and rude?
In the UK, some patients might think doctors are abrupt and rude, and I would sympathize with them. But I think it happens more so in developing countries where doctors are much less qualified, but are looked upon as the pillars of society, and they act as though they are gods, and they treat people like dirt. So yes, I agree with you, they're being dealt with badly in developing countries, and one of my jobs is to try and improve this interaction. And as I said earlier, we have to treat them as human beings who have come to you for help. And that's what medicine is all about. All you're trying to do is get a patient to better health. That's what a doctor does.
With this little boy, did you actually come to a diagnosis?
Well, there were one or two tests that I suggested on this patient that were to be carried out, which had not been thought of. And the other thing was the immediate management. And this child had not been eating and not been feeding very well, and the potassium was very low. And the fact that over the previous 4 or 5 days this child had gone off his feet was because he had hardly any potassium in his body. So one of the reasons, one of the things I suggested before I left was to get his potassium right, in which case he would get more strength to be able to even have some food. Okay. So there's the immediate management and obviously the management after he's been diagnosed.
I do disagree with you, Professor, and I think this is the first in the whole week that I've disagreed with you, that not a lot of interaction between doctors and patients is kind in the UK. I've been on the receiving end, as well as people I've spoken to been on the receiving end of doctors and nurses who also think they're mini gods here in the UK. Yes. What would be your professional and personal advice to those doctors within the UK who might not think being kind and gentle to their patients, young or old, is the right way forward?
Okay, there are two ways of dealing with this. One of them is, in this country, fortunately, we've got the right, democratic right to be able to complain, and you can complain to the line manager or whoever, or even write a letter, and an apology will almost certainly come. That's the first thing. The second thing is that in our teachings and training, we do put the human factor into it. And having said that, I agree with you totally that there are doctors and nurses that think that they are gods and that they are rude. I agree with you. But I would like to think this is a small minority rather than a majority.
I think we agree on that. And on that note, I say thank you so much once again.
It's been a pleasure. Tomorrow,
I might feel a little sad as that's the last of our installment this week on the big news.
Okay.
But it's been a pleasure having you tonight. And thank you so much for joining us. Join us tomorrow when you talk more about Midland International Aid Trust.